Welcome. In this video, you'll tackle 50 of the most difficult NCLEX questions on hematology and oncology, neutropenic precautions. These high-yield, exam-style questions are designed to strengthen your clinical judgment, test your prioritization skills, and prepare you for the challenging scenarios you may encounter on the NCLEX. Grab a pen, think like a nurse, and see how many you can answer correctly before the explanations. Question 1. A client receiving induction chemotherapy for acute myeloid leukemia has an absolute neutrophil count, ANC, of 350/mm superscript 3. During morning rounds, the nurse notices a bouquet of fresh flowers brought by the client's family. What is the nurse's priority action? A. Place the flowers on a shelf away from the client. B. Remove the flowers from the room and explain the reason to the family. C. Spray the flowers with disinfectant before returning them to the room. D. Keep the flowers if the client does not touch them. Answer. B. Remove the flowers from the room and explain the reason to the family. Rationale. Fresh flowers and plants can harbor bacteria and fungi that increase the infection risk for severely neutropenic clients. They should not be kept in the room when neutropenic precautions are required. Question 2. A nurse is planning care for a client with chemotherapy-induced neutropenia. Which nursing intervention is most appropriate to reduce the client's risk of infection? A. Take the client's temperature rectally every shift. B. Encourage frequent hand hygiene for everyone entering the room. C. Limit oral hygiene until the neutrophil count improves. D. Restrict the client from showering during hospitalization. Answer. B. Encourage frequent hand hygiene for everyone entering the room. Rationale. Hand hygiene is the single most effective measure to prevent infection in neutropenic clients. Rectal procedures should be avoided because they can introduce microorganisms. Question 3. A client with an ANC of 420/mm superscript 3 reports feeling chilled. The nurse obtains a temperature of 38.4 degrees Celsius, 101.1 degrees Fahrenheit. What should the nurse do first? A. Administer acetaminophen as prescribed. B. Notify the healthcare provider immediately. C. Apply cooling blankets to reduce the fever. D. Recheck the temperature in 1 hour. Answer. B. Notify the healthcare provider immediately. Rationale. Fever in a neutropenic client is a medical emergency that may indicate sepsis. Prompt evaluation and initiation of broad-spectrum antibiotics are critical. Question 4. Which meal selection by a client receiving neutropenic precautions indicates a need for further teaching? A. Baked chicken, steamed rice, and cooked carrots. B. Scrambled eggs with toasted bread. C. Fresh garden salad with raw spinach and tomatoes. D. Well-cooked pasta with meat sauce. Answer. C. Fresh garden salad with raw spinach and tomatoes. Rationale. Raw fruits and vegetables may contain microorganisms. Many neutropenic diets recommend well-cooked foods and avoiding raw produce unless specifically approved by institutional policy. Question 5. A nursing assistant is assigned to a client on neutropenic precautions. Which action requires immediate intervention by the supervising nurse? A. Performing hand hygiene before entering the room. B. Bringing fresh fruit that has not been washed to the client. C. Wearing gloves when handling body fluids. D. Reporting the client's oral temperature promptly. Answer. B. Bringing fresh fruit that has not been washed to the client. Rationale. Unwashed fruit can carry bacteria and fungi that place a neutropenic client at high risk for infection. Food should be properly prepared before consumption. Question 6. A nurse is teaching a client with severe neutropenia about visitors. Which statement by the client demonstrates correct understanding? A. Anyone can visit as long as they wear gloves. B. Visitors with colds or fever should postpone their visit. C. Young children are always safe visitors. D. Masks are unnecessary if visitors stay briefly. Answer. B. Visitors with colds or fever should postpone their visit. Rationale. Anyone with signs of infection should avoid visiting a neutropenic client to reduce exposure to infectious organisms. Question 7. A nurse is assessing a client receiving chemotherapy whose ANC is 300/mm superscript 3. Which finding requires the most immediate follow-up? A. Mild fatigue. B. Temperature of 38.2 degrees Celsius, 100.8 degrees Fahrenheit. C. Decreased appetite. D. Hair loss. Answer. B. Temperature of 38.2 degrees Celsius, 100.8 degrees Fahrenheit. Rationale. Even a low-grade fever in a severely neutropenic client may indicate a life-threatening infection requiring urgent intervention. Question 8. Which provider prescription should the nurse question for a client with profound neutropenia? A. Daily complete blood count. B. Rectal suppository for constipation. C. Oral saline mouth rinse every 4 hours. D. Intravenous broad-spectrum antibiotics for fever. Answer. B. Rectal suppository for constipation. Rationale. Rectal medications and procedures can damage the mucosa and introduce pathogens, increasing the risk of infection in neutropenic clients. Question 9. A client asks why daily oral care is important during neutropenia. What is the nurse's best response? A. It prevents chemotherapy from staining your teeth. B. It helps reduce bacteria that could enter your bloodstream. C. It increases your white blood cell count. D. It eliminates the need for antibiotics. Answer. B. It helps reduce bacteria that could enter your bloodstream. Rationale. Gentle oral hygiene reduces bacterial colonization and lowers the risk of bloodstream infections while minimizing mucosal injury. Question 10. The nurse is evaluating whether neutropenic precautions have been effective. Which finding is the best indicator of successful care? A. The client remains afebrile and shows no signs of infection. B. The client gains 2 kilograms during hospitalization. C. The client's platelet count increases. D. The client reports improved appetite. Answer. A. The client remains afebrile and shows no signs of infection. Rationale. The primary goal of neutropenic precautions is to prevent infection. Remaining free from fever and other signs of infection indicates successful nursing care. Question 11. A client receiving chemotherapy has an ANC of 280/mm superscript 3. During assessment, the client reports burning with urination but denies fever. What is the nurse's priority action? A. Encourage increased oral fluid intake and reassess later. B. Notify the healthcare provider because this may indicate infection. C. Explain that urinary discomfort is an expected chemotherapy effect. D. Administer an analgesic and document the finding. Answer. B. Notify the healthcare provider because this may indicate infection. Rationale. Neutropenic clients may not develop a significant fever despite having an infection. Dysuria is a possible sign of a urinary tract infection and requires prompt evaluation. Question 12. A nurse is caring for a client with severe neutropenia. Which action by a family member requires immediate correction? A. Using alcohol-based hand sanitizer before entering the room. B. Sitting in a chair several feet from the client's bed. C. Bringing homemade food prepared the previous day. D. Wearing a mask according to hospital policy. Answer. C. Bringing homemade food prepared the previous day. Rationale. Leftover or improperly stored food may harbor bacteria. Neutropenic clients should consume freshly prepared, properly cooked foods to minimize infection risk. Question 13. The nurse is preparing to assess a client with an ANC of 450/mm superscript 3. Which assessment finding should be reported immediately? A. White patches on the oral mucosa. B. Mild nausea after breakfast. C. Generalized weakness after chemotherapy. D. Hair thinning over the scalp. Answer. A. White patches on the oral mucosa. Rationale. Oral lesions or white patches may indicate oral candidiasis or another infection, which can rapidly worsen in neutropenic clients and requires prompt treatment. Question 14. A newly licensed nurse asks why intramuscular injections are avoided whenever possible in clients with chemotherapy-induced neutropenia. What is the best response? A. They increase the client's pain level. B. They can introduce microorganisms into the tissue. C. They reduce the effectiveness of chemotherapy. D. They permanently damage muscle tissue. Answer. B. They can introduce microorganisms into the tissue. Rationale. Skin punctures create a potential entry point for pathogens. Minimizing invasive procedures helps reduce the risk of infection in neutropenic clients. Question 15. A client receiving filgrastim after chemotherapy asks why the medication is prescribed. Which response by the nurse is most appropriate? A. It increases your platelet count to prevent bleeding. B. It stimulates white blood cell production to reduce infection risk. C. It destroys cancer cells that remain after chemotherapy. D. It prevents nausea caused by chemotherapy. Answer: B. It stimulates white blood cell production to reduce infection risk. Rationale: filgrastim is a colony-stimulating factor that promotes neutrophil production, decreasing the duration and severity of chemotherapy-induced neutropenia. Question 16. The nurse is planning discharge teaching for a client recovering from neutropenia. Which client's statement indicates a need for further teaching? A. I'll wash my hands frequently. B. I'll avoid crowded shopping centers during peak illness seasons. C. I'll check my temperature if I feel unwell. D. I'll clean my cat's litter box every day while wearing gloves. Answer: D. I'll clean my cat's litter box every day while wearing gloves. Rationale: even with gloves, handling pet waste exposes the client to microorganisms. Someone else should perform this task until immune function improves. Question 17. The nurse is reviewing laboratory results for several oncology clients. Which client is at the greatest risk for developing a serious infection? A. ANC2, 400/mm superscript 3. B. ANC1, 200/mm superscript 3. C. ANC 750/mm superscript 3. D. ANC 180/mm superscript 3. Answer: D. ANC 180/mm superscript 3. Rationale: an ANC below 500/mm superscript 3 indicates severe neutropenia, with the highest risk occurring as the ANC falls below 200/mm superscript 3. Question 18. A client with severe neutropenia develops a productive cough and shortness of breath. Which nursing action is the priority? A. Encourage coughing and deep breathing exercises only. B. Obtain prescribed cultures and prepare for prompt antibiotic therapy. C. Limit oral fluids until the cough subsides. D. Place the client in the Trendelenburg position. Answer: B. Obtain prescribed cultures and prepare for prompt antibiotic therapy. Rationale: respiratory symptoms in a neutropenic client may indicate pneumonia or sepsis. Cultures should be obtained promptly, followed by timely administration of prescribed antibiotics. Question 19. Which nursing intervention best promotes oral health in a client receiving neutropenic precautions? A. Brush with a soft bristled toothbrush after meals. B. Use a firm toothbrush to remove plaque thoroughly. C. Brush only once daily to avoid gum irritation. D. Use an alcohol-based mouthwash after every meal. Answer: A. Brush with a soft bristled toothbrush after meals. Rationale: gentle oral care reduces bacterial growth while minimizing trauma to the oral mucosa. Alcohol-based mouthwashes can dry and irritate the tissues. Question 20. The nurse is evaluating a client 1 week after discharge following chemotherapy-induced neutropenia. Which statement requires immediate follow-up? A. I've been washing my hands before meals. B. I developed a temperature of 38.1 degrees Celsius 100.6 degrees Fahrenheit last night, but waited to see if it would go away. C. I've been avoiding people who are sick. D. I make sure my meat is thoroughly cooked before eating. Answer: B. I developed a temperature of 38.1 degrees Celsius 100.6 degrees Fahrenheit last night, but waited to see if it would go away. Rationale: any fever in a recently neutropenic client should be reported immediately. Delaying medical evaluation can allow a life-threatening infection to progress rapidly. Question 21. A client with acute leukemia has an ANC of 320/mm superscript 3. While assisting with the morning bath, the nurse notices a small reddened area around the client's central venous catheter insertion site. What is the nurse's priority action? A. Clean the area with soap and water and continue monitoring. B. Cover the area with a dry dressing and reassess at the end of the shift. C. Notify the healthcare provider because localized redness may indicate infection. D. Remove the catheter immediately without further assessment. Answer: C. Notify the healthcare provider because localized redness may indicate infection. Rationale: even localized redness at a vascular access site may be an early sign of infection in a neutropenic client. Prompt evaluation is necessary to prevent progression to bloodstream infection. Question 22. The nurse is reinforcing home care instructions for a client with chemotherapy-induced neutropenia. Which statement by the client indicates correct understanding? A. I'll wear gloves when gardening. B. I'll avoid gardening until my immune system recovers. C. I'll garden only after taking my antibiotics. D. I'll garden if I wear a face mask. Answer. B. I'll avoid gardening until my immune system recovers. Rationale. Soil contains bacteria and fungi that can cause serious infections in neutropenic clients. Gardening should be avoided until neutrophil counts recover. Question 23. A client receiving chemotherapy asks why daily monitoring of the absolute neutrophil count, ANC, is important. Which response by the nurse is most accurate? A. It measures your body's ability to carry oxygen. B. It helps determine your risk of developing infection. C. It shows whether your chemotherapy is destroying cancer cells. D. It measures your blood's ability to clot. Answer. B. It helps determine your risk of developing infection. Rationale. The ANC reflects the body's ability to fight bacterial and fungal infections. Lower ANC values indicate a greater risk for life-threatening infections. Question 24. A client with severe neutropenia is scheduled for several diagnostic procedures. Which prescription should the nurse question? A. Blood cultures for a temperature of 38.3 degrees Celsius, 101 degrees Fahrenheit. B. Chest radiograph for persistent cough. C. Digital rectal examination for constipation. D. Urinalysis for complaints of dysuria. Answer. C. Digital rectal examination for constipation. Rationale. Rectal examinations should be avoided in neutropenic clients because they may cause mucosal injury and introduce microorganisms into the bloodstream. Question 25. The nurse enters the room of a client receiving neutropenic precautions and observes a nursing student arranging a vase of fresh flowers on the bedside table. What should the nurse do first? A. Remove the flowers and explain the rationale to the student. B. Allow the flowers to remain if they are placed away from the bed. C. Ask environmental services to disinfect the flowers. D. Wait until the instructor arrives before intervening. Answer. A. Remove the flowers and explain the rationale to the student. Rationale. Fresh flowers can harbor bacteria and fungi. Immediate removal protects the client and provides an opportunity for staff education. Question 26. A nurse is teaching a client with neutropenia about food safety. Which meal selection demonstrates appropriate understanding? A. Sushi with fresh vegetables. B. Medium rare steak with salad. C. Grilled chicken, mashed potatoes, and cooked green beans. D. Soft-boiled eggs with fresh sprouts. Answer. C. Grilled chicken, mashed potatoes, and cooked green beans. Rationale. Neutropenic clients should eat thoroughly cooked foods and avoid raw meat, raw eggs, unpasteurized products, and raw sprouts because they may contain harmful microorganisms. Question 27. The nurse is assessing a client with an ANC of 250/mm superscript 3 who reports a sore throat. Which action is most appropriate? A. Recommend throat lozenges and reassess tomorrow. B. Encourage warm saltwater gargles only. C. Notify the healthcare provider immediately for further evaluation. D. Explain that sore throat is an expected side effect of chemotherapy. Answer. C. Notify the healthcare provider immediately for further evaluation. Rationale. A sore throat may be an early indication of infection in a neutropenic client and requires prompt assessment and possible treatment. Question 28. The charge nurse is assigning clients to nursing staff. Which client should be assigned to the nurse with the most oncology experience? A. A client receiving iron therapy for chronic anemia. B. A client with neutropenia who developed chills and hypotension. C. A client recovering from a blood transfusion without complications. D. A client preparing for discharge after treatment for vitamin B12 deficiency. Answer. B. A client with neutropenia who developed chills and hypotension. Rationale. Chills and hypotension suggest possible septic shock, a life-threatening emergency requiring advanced assessment, rapid intervention, and experienced clinical judgment. Question 29. A client with severe neutropenia asks whether influenza vaccination is recommended. Which response by the nurse is best? A. Live vaccines should be avoided unless approved by your healthcare provider. B. All vaccines are safe during severe neutropenia. C. Vaccinations are unnecessary after chemotherapy. D. Only family members need vaccinations. Answer. A. Live vaccines should be avoided unless approved by your healthcare provider. Rationale: clients with severe immunosuppression should generally avoid live vaccines unless specifically recommended by their healthcare provider. Vaccination decisions depend on immune status and treatment plan. Question 30. A client receiving chemotherapy calls the oncology clinic and reports a temperature of 38.5 degrees Celsius, 101.3 degrees Fahrenheit, fatigue, and shaking chills. Which instruction should the nurse provide? A. Take acetaminophen and call back in the morning. B. Increase fluid intake and rest at home. C. Go to the emergency department immediately for evaluation. D. Wait to see if the fever resolves within 24 hours. Answer. C. Go to the emergency department immediately for evaluation. Rationale: fever accompanied by chills in a neutropenic client is an oncologic emergency. Immediate medical evaluation and early administration of broad-spectrum antibiotics significantly reduce the risk of sepsis and death. Question 31. A client with non-Hodgkin lymphoma has an ANC of 390/mm superscript 3. During the shift, the client develops watery diarrhea. What is the nurse's priority action? A. Administer an antidiarrheal medication immediately. B. Assess the stool, notify the healthcare provider, and obtain specimens as prescribed. C. Restrict oral fluids until the diarrhea stops. D. Encourage high-fiber foods to bulk the stool. Answer. B. Assess the stool, notify the healthcare provider, and obtain specimens as prescribed. Rationale: diarrhea in a neutropenic client may indicate an infectious process. Prompt assessment and stool testing help identify the cause and guide appropriate treatment. Question 32. A nurse is caring for a client receiving chemotherapy who has severe neutropenia. Which laboratory value should the nurse monitor most closely to evaluate the client's ability to fight infection? A. Hemoglobin level. B. Platelet count. C. Absolute neutrophil count, ANC. D. Hematocrit. Answer. C. Absolute neutrophil count, ANC. Rationale: the ANC is the most reliable indicator of infection risk. An ANC below 500/mm superscript 3 places the client at high risk for severe bacterial and fungal infections. Question 33. The nurse is preparing discharge instructions for a client recovering from neutropenia. Which statement requires further teaching? A. I'll use an electric razor instead of a blade. B. I'll avoid people who have colds or the flu. C. I'll call my provider if I develop a fever. D. I'll receive all vaccinations without consulting my healthcare provider. Answer. D. I'll receive all vaccinations without consulting my healthcare provider. Rationale: vaccination schedules may need to be modified after chemotherapy. Clients should consult their healthcare provider before receiving any vaccine, especially live vaccines. Question 34. A client with severe neutropenia is scheduled for routine oral care. Which nursing intervention is most appropriate? A. Use lemon glycerin swabs every 2 hours. B. Brush gently with a soft toothbrush and rinse with saline. C. Use a firm toothbrush to remove plaque. D. Avoid brushing until the white blood cell count normalizes. Answer. B. Brush gently with a soft toothbrush and rinse with saline. Rationale: gentle oral care reduces bacterial growth while preventing trauma to fragile oral tissues. Saline rinses help maintain oral hygiene without causing irritation. Question 35. The nurse is assessing a client with chemotherapy-induced neutropenia. Which finding is the earliest indicator of possible sepsis? A. Temperature of 38.4 degrees Celsius, 101.1 degrees Fahrenheit. B. Platelet count of 90,000/mm superscript 3. C. Hemoglobin of 10G/dl. D. Alopecia. Answer. A. Temperature of 38.4 degrees Celsius, 101.1 degrees Fahrenheit. Rationale: fever may be the only early sign of infection in neutropenic clients. Immediate evaluation is essential because sepsis can progress rapidly. Question 36. A nursing assistant is caring for a client on neutropenic precautions. Which action should the nurse intervene to stop? A. Performing hand hygiene before entering the room. B. Taking fresh-cut flowers from the room after being reminded. C. Bringing the client unpasteurized fruit juice from the cafeteria. D. Reporting that the client refused lunch. Answer: C. Bringing the client unpasteurized fruit juice from the cafeteria. Rationale: unpasteurized beverages may contain harmful microorganisms and should be avoided by neutropenic clients. Question 37. The nurse is teaching a client with severe neutropenia about personal hygiene at home. Which instruction is most appropriate? A. Bathe daily using mild soap and dry the skin thoroughly. B. Avoid bathing to reduce skin irritation. C. Share towels with family members if they appear clean. D. Use hot tubs to promote circulation. Answer: A. Bathe daily using mild soap and dry the skin thoroughly. Rationale: daily hygiene helps reduce the number of microorganisms on the skin while maintaining skin integrity, an important barrier against infection. Question 38. A client receiving chemotherapy asks why fresh flowers and potted plants are prohibited during neutropenia. Which response by the nurse is best? A. They attract insects into the room. B. They may contain bacteria and fungi that can cause serious infections. C. Their fragrance may interfere with chemotherapy. D. Hospital policy prohibits all gifts. Answer: B. They may contain bacteria and fungi that can cause serious infections. Rationale: soil, stagnant water, and plant materials can harbor microorganisms that pose a significant infection risk to immunocompromised clients. Question 39. A client with severe neutropenia is preparing for discharge. Which statement indicates the need for additional teaching? A. I'll wear a mask if I'm instructed to in crowded healthcare settings. B. I'll report any fever immediately. C. I'll eat raw oysters only if they look fresh. D. I'll wash my hands frequently. Answer: C. I'll eat raw oysters only if they look fresh. Rationale: raw seafood can contain dangerous bacteria and should be avoided by neutropenic clients regardless of appearance or freshness. Question 40. A nurse is caring for a client with chemotherapy-induced neutropenia who suddenly becomes confused, febrile, and hypotensive. Which action should the nurse take first? A. Encourage oral fluids. B. Activate the sepsis protocol and notify the healthcare provider immediately. C. Reassure the client that confusion is expected after chemotherapy. D. Administer an antipyretic and reassess in 1 hour. Answer: B. Activate the sepsis protocol and notify the healthcare provider immediately. Rationale: fever, hypotension, and altered mental status strongly suggest septic shock. Early recognition, rapid initiation of the sepsis protocol, cultures, intravenous fluids, and broad-spectrum antibiotics are critical to improve survival. Question 41. A client with chemotherapy-induced neutropenia asks whether it is safe to receive fresh flowers from family members after discharge. Which response by the nurse is most appropriate? A. Fresh flowers are safe if they remain in another room. B. Avoid fresh flowers until your healthcare provider says your immune system has recovered. C. Fresh flowers are acceptable if someone changes the water daily. D. Only artificial flowers are prohibited. Answer: B. Avoid fresh flowers until your healthcare provider says your immune system has recovered. Rationale: fresh flowers and plants may contain bacteria and fungi that increase the risk of infection in clients with severe neutropenia. Question 42. A client with an ANC of 220/mm superscript 3 is scheduled for discharge. Which instruction is the nurse's priority? A. Drink at least 3 liters of water daily. B. Check your temperature daily and report any fever immediately. C. Exercise vigorously to improve your immune system. D. Limit sleep during the day to avoid fatigue. Answer: B. Check your temperature daily and report any fever immediately. Rationale: fever may be the first and only sign of a serious infection in neutropenic clients. Prompt reporting allows rapid treatment and reduces the risk of sepsis. Question 43. The nurse is reviewing provider prescriptions for a client with severe neutropenia. Which prescription should be implemented first? A. Encourage ambulation 3 times daily. B. Obtain blood cultures and administer prescribed 4 broad-spectrum antibiotics. C. Begin a high-fiber diet. D. Schedule physical therapy. Answer: B. Obtain blood cultures and administer prescribed 4 broad-spectrum antibiotics. Rationale: suspected febrile neutropenia is an oncologic emergency. Blood cultures should be obtained promptly, followed by timely administration of broad-spectrum antibiotics. Question 44. A nurse enters the room of a client receiving neutropenic precautions and notices a visitor coughing repeatedly. What is the nurse's best action? A. Ask the visitor to wash their hands and continue the visit. B. Request that the visitor postpone the visit until they are symptom-free. C. Offer the visitor tissues and allow the visit to continue. D. Move the client farther away from the visitor. Answer: B. Request that the visitor postpone the visit until they are symptom-free. Rationale: visitors with signs of illness should not visit neutropenic clients because they may transmit infectious organisms. Question 45. A nurse is caring for a client receiving chemotherapy who has severe neutropenia. Which assessment finding requires immediate intervention? A. Temperature of 38.6 degrees Celsius, 101.5 degrees Fahrenheit, with chills. B. Decreased appetite after lunch. C. Mild generalized weakness. D. Hair loss over the past 2 weeks. Answer: A. Temperature of 38.6 degrees Celsius, 101.5 degrees Fahrenheit, with chills. Rationale: fever with chills in a neutropenic client strongly suggests infection and requires immediate evaluation and treatment to prevent septic shock. Question 46. A client with neutropenia asks which activity is safest during recovery at home. Which recommendation should the nurse provide? A. Visit crowded shopping malls during off-peak hours. B. Swim in a public pool 3 times a week. C. Take short walks outdoors while avoiding people who are ill. D. Attend large family gatherings if everyone feels healthy. Answer: C. Take short walks outdoors while avoiding people who are ill. Rationale: light outdoor activity is generally appropriate if approved by the healthcare provider, but exposure to crowds and potentially infectious individuals should be minimized. Question 47. The nurse is evaluating whether a client understands neutropenic precautions. Which statement by the client indicates correct understanding? A. I'll avoid cleaning bird cages and fish tanks. B. I'll eat soft-boiled eggs because they're easier to digest. C. I'll stop brushing my teeth if my gums become sore. D. I'll wait until my next appointment to report a fever. Answer: A. I'll avoid cleaning bird cages and fish tanks. Rationale: animal waste and aquarium water may contain microorganisms that can cause serious infections in immunocompromised clients. Oral hygiene should continue with a soft toothbrush, and fever should be reported immediately. Question 48. A nurse is caring for a client with severe neutropenia who suddenly develops hypotension, tachycardia, and altered mental status. Which action is the priority? A. Administer prescribed 4 fluids and broad-spectrum antibiotics as ordered. B. Encourage oral fluids and bed rest. C. Reassess the client in 30 minutes. D. Obtain a routine weight before notifying the provider. Answer: A. Administer prescribed 4 fluids and broad-spectrum antibiotics as ordered. Rationale: these findings are consistent with septic shock. Rapid fluid resuscitation and timely antibiotic therapy are life-saving interventions. Question 49. A nurse is providing dietary teaching to a client recovering from chemotherapy-induced neutropenia. Which food choice should the nurse recommend? A. Unpasteurized milk. B. Rare roast beef. C. Thoroughly cooked fish with steamed vegetables. D. Fresh alfalfa sprouts. Answer: C. Thoroughly cooked fish with steamed vegetables. Rationale: well-cooked foods reduce exposure to bacteria and other pathogens. Raw or unpasteurized foods should be avoided during neutropenia. Question 50. A nurse is evaluating the effectiveness of neutropenic precautions for a hospitalized oncology client. Which outcome best indicates that the nursing interventions have been successful? A. The client remains free of infection throughout hospitalization. B. The client's appetite has improved. C. The client reports sleeping 8 hours each night. D. The client's hair has begun to regrow. Answer: A. The client remains free of infection throughout hospitalization. Rationale: the primary goal of neutropenic precautions is to prevent infection while the client's immune system is compromised. Remaining afebrile and free of clinical signs of infection is the best indicator of successful nursing care. Great job making it to the end. Consistently practicing challenging NCLEX questions like these is one of the best ways to build confidence and improve your clinical decision-making. If you missed a few questions, review the rationales and try again. You'll learn something new every time. Stay focused, keep practicing, and all the best on your NCLEX journey.